The Infinity Knee System is a modular platform for ACL reconstruction that supports a variety of surgical approaches, reaming, and fixation preferences for both soft tissue and bone-tendon bone fixation. To begin, debride unwanted remnant ACL tissue and mark the center of the desired ACL tunnel position. Then, take the Infinity anteromedial guide and front-load the Infinity 3.5mm spade tip guide pin. Insert through the anteromedial portal while the knee is hyperflexed to allow appropriate access to the ACL's femoral footprint. The anteromedial guide provides a 2mm offset from the back wall. With the guide still in place, use the Hall Microfree mini driver to advance the guide pin through the far femoral cortex. Then remove the guide from the joint and pull the guide pin back against the femoral cortex to confirm femoral aperture to cortex length. The spade tip guide pin's gradient pattern helps quickly identify AC length while under direct visualization. Advance the guide pin through the skin laterally and introduce the sentinel reamer over the pin. Keep the cutting flute away from the medial condyle. Then ream the femoral socket. A 20 to 25mm tunnel is recommended to aid in the placement of the graft's femoral bone block when using an anteromedial approach. Remove the reamer from the joint. Load a passing suture into the guide pin eyelet and pull the guide pin out to advance the femoral passing loop into the joint. Next, assemble the Infinity modular guide system, which features a quick connect mechanism on the guide body and ratcheting edge on the guide sleeve. Place the tip guide's point at the center of the ACL footprint and advance the guide sleeve firmly against the tibia. Then, advance a 2.4mm tibial guide pin until it meets the tip of the guide arm. Remove the guide from the joint. Then use a constant diameter reamer to ream the tibial tunnel and prepare for graft passing. It is recommended to upsize the tibial reamer by 0.5 mm compared to your largest area of graft diameter to ensure smooth passage of the graft into the joint. Next, retrieve the passing suture out of the tibial tunnel and load it with the second passing suture that has been attached to the B2B graft. Once the graft is seated, insert the HyperFlex guide wire proximally between the femoral tunnel wall and the bone block. Load the Easy Start interference screw onto the 3.5mm hex driver and insert over the HyperFlex guide wire. Utilize the conical tip of the screw to self-notch between the femoral tunnel and bone block. Rotate the driver clockwise until the self-tapping threads engage bone and advance the screw forward until flush with the tunnel walls. Then, place the leg in extension and repeat the Easy Start insertion process to complete tibial fixation. Finally, remove the passing sutures and close to complete the ACL reconstruction.